So, very good morning to all of you joining here on site as well as online. I'm Pamod Amarakoon, representing the DHIS2 Center at the University of Oslo, and I coordinate the DPG and DPI related activities at the DHIS2 Center, and we will talk more about what these DPGs and DPIs are. And this is one session that those of you who have been here for the last few years, you may have noticed that at least in the last 3 years, we have had this DPG session in all of our annual conferences. Right? So that's something remarkable. On one topic, we have been having each year a particular session, and that kind of shows the commitment and the interest shown by the DHIS2 Center for the concept of digital public goods and digital public infrastructure, and what kind of engagements we have on diverse aspects with the DPG community. So for this year, we have a special topic because last few years we have been talking more about how the HISP and the DHIS2 has been engaging with the DPGs, how it at platform level, technology level, and at implementation level, working with the communities in the countries. And this year it's very special because we are now talking more about how we are engaging with the broader DPG network in supporting countries. So this year we have a few other digital public good product owners present here today. So the plan today is we will have an introduction, a presentation on the digital public goods and digital public infrastructure in general, focusing more on how we can build the ecosystem at country level. And followed by that, we will have a panel discussion with some of the digital public goods present here. So we will have some very fundamental questions, and we will open up later to have more questions from the audience. So as the first item, as usual, in a couple of our previous events as well, we are going to invite Liv Marte from, she's the CEO of the Digital Public Goods Alliance, and she'll be talking about how to build local implement ecosystems related to the DPGs.
Thank you, Pamod. It's such a pleasure to be here. Is it my fourth something? And it's also really a pleasure to be part of a panel afterwards with so many digital public goods. And I think that goes to the essence of what Pamod was just saying, that we're talking about the community much more than instead of individual products. But let me start very quickly, maybe by saying what the DPGA is and what digital public goods are, because we can't expect everyone to be super familiar with these acronyms that we have. So the Digital Public Goods Alliance is a UN-endorsed multi-stakeholder initiative that came out of a high-level panel that the UN Secretary General convened in 2018, where the aim was to see how could international digital collaboration really be accelerated to advance attainment of the Sustainable Development Goals. And this was a very, very broad panel. And one of the few, and from a geopolitical perspective, it was also very interesting. It was co-chaired by Jack Ma and Melinda Gates. I don't think that would have happened now. So it was interesting, and it's not that long ago. But this panel had politicians, but mainly experts, I would say. So there was this group of 20 people, and there was a lot of back and forth on very sensitive and how to say, like complex, hairy topics. But one of the topics where there was most alignment was around the potential for leveraging more open source technologies for advancement of the Sustainable Development Goals. There was a lot of, particularly from an international development perspective, there was a sense that there was so much duplication of efforts, so much fragmentation, so many things that were funded again and again and again to do the same thing, sometimes slightly worse than the previous thing that had been funded to do the same thing. And so this was a no-brainer, where I would say there was a lot of alignment, and it led to the formation of the Digital Public Goods Alliance as a follow-up to the famous recommendation 1B in the high-level panel report. And today, so this alliance was co-founded by 4 stakeholders, and now there's 44 members, many countries, many UN entities, and also a big part of the open source ecosystem Creative Commons, OSI, Open Knowledge Foundation, for those of you who know the different like open source entities, and also stakeholders like GitHub. So it's it has grown a lot, many foundations and think tanks as well, and everyone, and what brings the membership together is as a glue kind of is this shared interest in the topic of digital public goods. And then we have the digital public goods themselves. And so what we do at the Secretariat of the Digital Public Goods Alliance that I lead, for a small group, 12 people, we maintain a standard and a registry of digital public goods, which means that we assess technologies as to how they meet certain criteria or relevance. And there's three core dimensions. One of them is advancing the Sustainable Development Goals. It's a pretty broad tent, I would say, in the sense that you have an infrastructure goal, for instance, SDG number 9. So it's not necessarily so hard to meet this particular criteria, but there is this still perspective that it needs to be for the good somehow, and there needs to be a justification that there is a public interest intention, so to speak. Then there's the open component, which looks into the licensing, but also documentation and platform independence. So it's more than just someone having, published something on GitHub. It's about proper aiming for reusability, as in adoptability and adaptability. So this is something which distinguishes digital public goods from the kind of broader landscape of all open source, is that they are typically, ideally, more adoptable and adaptable. And the last and very important part is do no harm by design. Notice by design. It's very hard to control how something is implemented downstream, but the idea is at least that there has been conscious thinking about how to minimize the risk of doing harm from a technology. So this is the DPG standard, and today in the registry that you can find on our website, I think you'll see the link at the very end of the slide, digitalpublicgoods.net. You will find a registry with 200 plus digital public goods in it. DHIS2 is one of them. And I would say that DHIS2 predates the Digital Public Goods Alliance significantly, and has been very formative, I would say, for the whole concept of digital public goods, in that it has existed and been a proof in practice of what happens when something is open source in combination with a vibrant community around it. So today this landscape is growing, and we have many digital public goods here today, who I look forward to hearing from afterwards. So this is the framing. And you guys probably know this very well, but there's the merits here, and also how we communicate this often is the why it matters from a country perspective or from a stakeholder perspective to adopt a DPG, or to also share a DPG. So it's the open source and accessibility. So the opportunity to be able to adopt something to meet your specific needs. It's the control. And as Pamod was mentioning, he talked about digital public infrastructure. That's what we're talking about today. And when we use the term digital public infrastructure, we're typically talking about the technologies that are most foundational, that many other things build on top of, the ones that are typically cross-sectoral, society scale in their implementations. And if they get hijacked, it has implications throughout the entire value chain. And if you get monopoly structures that controls your digital public infrastructure, it really limits the sovereignty and the opportunity for countries to have agency in their own digital transformation and development journeys. So this sovereignty aspect, and again, geopolitics are changing, and I think everyone is very aware of this these days. Customization, again, the ability to tailor to your specific needs. And also, and for number 4, we've written often, often cheaper and faster to implement, not necessarily always, but in a long-term perspective, particularly given the change needs that you can't predict upfront, and the opportunity to evolve and maintain these systems over time, the total lifetime cost, and also the capacity built as part of implementing them. We stand by the cheaper and faster and better. And lastly, the topic of today is the opportunity to catalyze local ecosystems and local capacity. And this is something that is very, very linked to the objective of agency control sovereignty. And something we hear from many, many countries is this: why can't we build up our own community, our own capacity? We need this also to be able to move from being users and adopters, also being creators. So this agency that comes with actually being involved in doing something. And here I just wanted to put up, and I guess maybe they are, I don't know if they're provocations, but some ideas, and I'm keen to hear what the different DPGs think about this, is how can we catalyze more of this local capacity? I have worked a lot on procurements myself, and it's a topic that people tend to hate. It's not sexy, it is bureaucratic, it's rigid, and it's where the big money goes, typically. So government procurements are, for good and for bad, something that has to be dealt with. I actually think they can be quite useful as well, but how they are done will have huge implications also for local capacity development. One of the things we're arguing a lot for at the Digital Public Goods Alliance is open source first policies. Not open source only, but open source first, meaning please consider what already exists when you're considering the procurement of a new solution. And make sure to benchmark your needs against what you can find open source before going out and asking for a proprietary version of that thing that already exists open source. In this landscape, countries, governments play a large role, but also the multilateral agencies, international financing institutions like the World Bank play a big role in influencing procurement systems. And I've written large SIs, as in systems integrators, so the big vendors, international companies, are also very influential. And what we see, sometimes they are the ones, and I see Arun and Mosip over there, sometimes they are the ones bidding for the use of a DPG. We have an example from Trinidad and Tobago, for instance, with Mosip. And the question is how these contracts get set up can have big implications also for the local vendor capacity building. And I've written, and this is from my own experience, pre-tech, so I don't know how much it applies, but I do think there is this topic of local content, which is something that we discussed a lot in Norway when Norway built up its petroleum industry. It was this requirement to use local companies. And I think sometimes these are discussions that happen also in tech. And I think it's a topic that is an important topic to explore, but it also has pitfalls. Because you need, if there is to be local content requirements, you also need to have capacity, and there is a corruption risk sometimes associated with requiring something. So I think the topic still of how can you encourage that local companies get an opportunity to be part of competitive contracts is very, very important, and it's something that has to be planned for. One way to plan for it can be how you structure deliverables in procurement, so that they're structured in a way where there are components, at least, that local companies can have comparative advantages and actually be competitive in. So that's one area that I think, and again, I'm keen to hear from the Digital Public Goods who have experience in doing this in practice. And then I just wrote catalyzed through creation, as in the going from the being involved in the customization, adaptation, and doing something to also moving towards building new things. And this, how to encourage this, I think it's also a mind shift sometimes. And I think it is very important to encourage, and we see a lot of discussions around it. Last week, there was Sierra Leone hosted a big tech conference, a tech summit. It was moved a bit the date, so I wasn't able to go there. But what I know that Sierra Leone has done, and Sierra Leone is one of the founding members of the DPG, is that they're working on this DPG or DPG pipeline, where the idea is that they have they share ideas and needs from and I think the government itself is very active in trying to get needs mapped out and shared with this local creative community. And there is a pipeline that we're trying to build where there's also an opportunity to mobilize different types of financing opportunities into matching that with the pipeline. So this is like, there's exploration happening on this. I know UNICEF is involved in this particular example, but how to stimulate more creation capacity. And I'm using Sierra Leone as an example because Sierra Leone is also, I think, ranking among the 10 lowest in the Human Development Index. So I'm just mentioning that this can happen also in very, very low income settings. And it needs to happen also in low income settings, but how it gets set up matters. And I really admire the willingness to drive that. And then, and this is also a bit similar. So I think the DPGs themselves are very important tools for local capacity building and how we can set that up. And again, it's almost a question, but here are some thoughts, because what you see is very often the discussion about the potential adoption of a DPG in a country, at least I've seen this with MOSIP, it can go on for a long, long time before it actually happens. So typically there's at least like, you know, that there's an assessment of, and you know that there is an established, that there's a need. It's typically been communicated that some kind of digital ID is going to be built out, or a CRVS, I know Ed is on the line. So there's often awareness that there's an opportunity coming, and how to proactively then try to strengthen at least local capacity and familiarity with the relevant DPGs that are being considered upfront. So here I've written the opportunity for using that time more strategically. And the DPGs themselves have come pretty far now in documentation, training materials, and different types of certification approaches. Again, I'm keen to hear where this stands now. And also, I think this is for the funders, a topic that can be supported. So there's other support streams that are also very important from a financing perspective. But how can funders, there's often a lot of local private sector development programs happening in countries. How could this be built into it to build open source capacity on high relevance open source? And I think DPGs would fall under that, often fall under that category. And lastly, I think it's lastly, or maybe almost lastly, catalyzed through community. And here I've used, not used as an example, I'm thinking of HIS, not as an example, but as the ultimate, one of the biggest communities I think that exists in this space, or probably the biggest. So the structure of the HISP hubs as something that's been built painstakingly and with a very, very strong also academic component. There's been so much investment in this structure and this ecosystem that has flourished around not only DHIS2, because I think that's what has happened, right? There's substantial open source implementation capacity in the countries, but also in the regional hubs through HISP that support countries. And how can this also then be tapped into to build more local capacity around these other DPGs that are in high demand? And I also love the model that HISP has used to build capacity through academia, and also work that there's this academic connection, because academia typically has the opportunity to think more long term. That's part of what academia does. It's to have the long-term public interest in mind. It's typically what it's, at least it's at the ethos. And there's also mechanisms like PhD stipends and the opportunity to actually stay engaged and stay on task for key people, sometimes in the government even, to be involved in doing then implementation research, for instance. And that model, I think, is very, very important. Yeah, it was the last. So with that, I would love to welcome Pamod back, and I look forward to a good discussion with my panelists. Thank you.
Thank you very much, Liv. Yes, talking about academia, I must also mention the PhD program that we are running at the University of Oslo for like last 2 years now, specifically on DPI, and we must thank NORAD for supporting that PhD program, and we will be seeing a lot of publications that are coming out of the DPGs and DPI work that our candidates have been doing over the years. So, Liv, please join the panel here. So let me invite some of the DPGs that are present here to join the panel discussion. So I will call out the names. Jeremy Jocelyn from OpenSPP. Alexa Cross from OpenFN, Derek Lugao from Community Health Toolkit, Arun Gurumurthy from MOSIP, and Mike Frost from DHIS2. And we also have Ed Duffus joining online from OpenCRVS. All right, yeah. Okay, so now that we have the panelists, I don't know how many of you who are in this audience who are mostly from a DHIS2 background are familiar with this panelist here. So let me invite all of you to briefly introduce who you are and what's the product you are representing, and then how you have been collaborating in the DPG ecosystem. So maybe we can start with Jeremy.
Yeah, well, it's over here. It's okay. Yeah, it's gonna be here. So yes, thank you very much. So I'm Jeremy Jocelyn. So I'm the founder of a public good called OpenSPP. So we started around building a social protection management information system for humanitarian, but also for governments. And we evolved over time from moving from just management information system to social registry and farmer registry. We've been working with countries like Togo, Laos, Sri Lanka, Philippines, Yemen to build like this infrastructure for and with the government. One of the key things, as was mentioned earlier, is like we want to work with the local ecosystem, right? I mean, like a lot of the things we do, agriculture, social protection, it's very localized, right? Has a lot of cultural aspects. So we do a lot of work with the local entities. So yeah, that's what we do.
Thank you, Jeremy. And next, Alexa.
Everyone, good morning. My name is Alexa. I'm co-founder and COO at Open Function, where we work on data integration and workflow automation. So not just getting information into one place, but there's lots of processes, like business processes that cut across the different digital systems that we use. So we're in the business of helping people think about how to digitize those processes that cut between systems to automate a lot of the paper pushing, really tedious work, and help to kind of strengthen these other technologies that are already in place. So as an example of that, later today, the DPG team in the Innovative Use Cases session will be chatting about how they're using OpenFN to connect DHIS2 with an identity platform and a birth and death registration authority. And so they're using DHIS2 to register births that happen outside of hospitals. And with OpenFN, as soon as that registration happens, they can send those registration details to the ID authority and generate a national ID. They can then send those details to the birth and death registry and generate a birth certificate, send all that information back to DHIS2, and then send a mother an SMS with the information so that the mother doesn't have to travel from a rural area into government offices to go through the process of applying for a national ID, getting all that paperwork, and can immediately be eligible for a lot of social programs and health programs instantly. So really, really excited to be here today and learning more from the other digital public goods.
Thanks, Derek from Community Health Toolkit.
Morning, everyone. I'm Derek Lungaho, working medic. We build the open source community health toolkit and also steward the community around it. The CHT is used in digitalizing community health service delivery. We support use cases around reproductive, maternal, child health, WASH, surveillance, among many others. We empower about 160,000 community health workers globally, around 21 countries. Our largest program is in Kenya with about 106,000 community health workers that scaled up in about 18 months. And over the years, we've leveraged other DPGs, DHIS2, OpenFN, and others not in the room to ensure that we provide a robust solution to the governments we serve. Happy to be here.
Arun from MOSIP.
Good morning, all. This is my first time at the DHIS2 conference, so I'm excited. I'm the Chief Strategy Officer for MOSIP. MOSIP is an acronym for Modular Open Source Identity Platform. It's fundamentally large-scale software platform which enables governments to deploy national foundational identity systems, including identity management, identity lifecycle management, and identity verification. That goes into any country's infrastructure. It's typically white labeled and governments rebrand, customize, configure, and rebrand it. Just to give you an example, Ethiopia's national ID system is called FIDA. It's based on MOSIP. Philippines' national ID system is based on, it's called PhilSys. It is based on MOSIP. Uganda recently transitioned their older identity system to a newer platform. It is based on MOSIP. We manage the underlying technology. We keep it relatively bug-free and up to date. We also build a we also build an active commercial ecosystem because we don't want to be going around implementing these large-scale systems, because these systems have to meet legal and regulatory and privacy and security requirements. So there are liability and ownership questions. But we do intensively work with governments and the commercial ecosystem to build the necessary capacity to go out and implement. These systems typically scale at population. Philippines has onboarded 90 million of the 100 million population. Ethiopia is onboarding 120 million. Nigeria will transition all of the 200 million people onto these systems. So typically these are once in a decade or 2 decades endeavors for governments. In that sense, our work is quite intensive and the model is complicated. What has happened in the process is that MOSIP itself has spawned a number of smaller products which in itself are useful. Somebody need not go for an entirety of the platform, can use the modularity and interoperability to onboard useful features on top of their identity system. A useful example is Cambodia. They have a good identity system per se, but it does not offer very robust verification services. So Cambodia is implementing only the verification layers to quote unquote upgrade their systems. Looking forward to the journey. It's a lot to learn from this ecosystem. I'm excited to be here. Thank you.
Thank you. And DHIS2 does not need introduction, but Mike, you do.
Yeah, sure. So I'm Mike Frost here at the HISP Center. And those of you that do know me have known me as the Tracker product manager for the last 8 or 9 years. But that's changed where we've, here at the university, we have a lot of new efforts around partnering and collaboration, which is where I'm working now, and very excited to have all of these DPGs here with us in the DPG Alliance, because that's specifically what we're working on, is creating stronger connections to these other complementary platforms and our own relationships of how we work together. So maybe we'll get into that a little bit on the panel, but very happy to have all of them with us.
Thank you. And finally, we have OpenCRVS joining online. So over to you.
Thanks very much. Can you hear me okay?
Yes, we can.
Super. Apologies, I can't be with you in Oslo. I'm Ed Duffus. I'm the co-founder of OpenCRVS. It's a open source platform that supports digital civil registration processes in country. So typically that's the registration of births, deaths, marriages, divorces, and many other life events. Designed specifically for low and middle income countries. It's a highly configurable product, meaning that it's adaptable to meet the specific needs and the registration processes of different countries, which are typically highly legislated for. So they need to be implemented in a particular way. Interoperability is key for us. So we're proud to already be interoperable with a number of the other DPGs on the panel, which is great. And we have features in OpenCRVS which make sure it can be used in really hard to reach locations. There's offline functionality, which means that births and deaths can be declared and captured fully offline and then synchronized later to the server for later registration processes. We've come a long way in the sort of 5 years since we've existed. We're not-for-profit based in the UK. We now have a number of deployments around the world, either implemented by us as an organization or our growing implementation partner ecosystem. We recently had a live deployment in Tonga, which was led by one of our implementation partners. In fact, it's an interesting case because in Tonga, OpenCRS was used and integrates with MOSIP, the identity platform. A number of Pacific islands are already using OpenCRVS. We have live deployments in Somalia, Uganda, Burkina Faso, Madagascar in Africa, and a pilot project in the Philippines at the moment. So you can see there's a match-up with some of the other projects going on with the other DPGs. Just a brief word on the sort of implementation ecosystem, which of course you'll be very interested in. Obviously, the OpenCRS organization, it won't be us that's going to be able to scale OpenCRVS as a high-quality digital civil registration system around the world. It'll be through the partner ecosystem. So we've been building this over time. We have a partner program. So all of our skills building material is available, of course, online. I'll share the link in just a second. And it's very important for us because we interface often with governments who are asking how OpenCRS can be implemented, and we point them to our partner ecosystem as a set of implementers that we know are trusted and are able to implement at a high quality. Currently, we have 2 accredited implementers as part of that program, but that's increasing in number very, very fast, and we'll soon have more accredited partners to really sort of make a robust implementation ecosystem. Thank you.
Great, thank you very much. So we as the HISP Center has been in dialogue with most of the DPGs present here over the last few months on discussing how best we can collaborate to better support countries. So while there are many facets when you talk about collaboration, one thing that is easily presentable and for most of you will be more tangible is to discuss like how these collaborations can work across the different solutions at a very technical level related to a use case. So on behalf of all the DPGs here, I invite Jeremy to kindly present one of the use cases that we have been discussing. So there could be many more, and we really believe this presentation that he is presenting now will trigger more discussions in our Q&A session as well as afterwards. So over to you, Jeremy, very briefly.
Yes, thank you, Pamod. So very briefly, like this is just an idea and fictional example based on some experience we had, but like this can be very different depending on the countries, right? So the idea is here, so a child is born, so the registration is being done in Community Health Toolkit. And Community Health Toolkit is notifying the birth through DHIS2 tracker or directly to the CRVS, for example, right? Like which register this birth and trigger the ID enrollment into the national ID. So in the national ID here is MOSIP, which then can issue the national ID. And then this number and this document is received by the parents, right? So then for social protection type of use case, then the parents would then register their child as part of their household, right? So they do a request to add a child to their household to be able to receive entitlement. And so then this is sent to OpenSPP. And then OpenSPP is doing a couple of verifications behind it, right? So authentication can be done with MOSIP. So Arun was mentioning about eSignet to authenticate the parents. And then we would be able also to send the birth certificate information from OpenCRVS through the API, verifying this information, verifying the information about the parents, and making sure it's correct. And if it's correct, then updating the household, right? And then let's say another use case after is the child, for example, come to see a doctor for a visit. So again, we would start with Community Health Toolkit, Medic, so recording the health checkup through their mobile app offline. Then this data is synchronized through OpenFN, which receive this data and push it into DHIS2. And then you're much more specialist of DHIS2 than me on how it works, but very quickly is DHIS2 can receive this information, verify it again, like with a national ID, with a domain-specific ID from MOSIP, confirming the identity, and then this data is being sent to DHIS2 aggregate store for doing the reporting. And then we have here also OpenFN. So OpenSPP has an integration with OpenFN and DHIS2 as well. So basically, OpenFN is pushing the data from DHIS2 from this verification to OpenSPP. So then we can trigger a compliance verification for a program, right? So let's say household is enrolled into a program, and one of the compliance criteria is that the child receive its vaccination. So this can trigger this, and then OpenSPP can then push a cash transfer, for example, through mobile money providers. So yeah, very quick.
Thank you, Jeremy. And I think Jeremy kind of in like 3 minutes presented to you something very complex. And it is complex, right? So all our country systems are complex. So challenge for most of you who are DHIS2 experts and who have been using DHIS2 is just think how best, I mean, are there any other use cases that you can think of where we can leverage DHIS2 and also integrate with other the DPGs that are presented here and those of the other ones that you are aware of. All right. So without wasting much time, let me also join the panel. All right. So, okay. So let's start with with a question, and of course, a product that is familiar to all of you, which is DHIS2. So why? Now, DHIS2 has been around, and the HISP has been around for a couple of decades, more than 3 decades, right? So, and we are present in more than how many countries? 80, even 100 plus?
130.
130. Okay, fine. So now some of the DPGs here are quite new, and they are starting to scale in most of the countries. So what are the learnings and experiences from DHIS2 and HISP that you think will be valuable for the DPGs who are present here and those of others who are joining online?
Yeah, thanks. So I think, and I'm very happy to have this closer collaboration, just to say, because I think that what we see as kind of the primary reason DHIS2 has been successful is because of an approach of talking to the countries, keeping the Ministry of Health in our mind as the main client, and fostering choice. That's the idea, is that they have digital sovereignty. They're the ones that own their system, and they should be able to make choices. And it's great to have more and more platforms covering different sectors and areas that are available as options. And so I think the hard problem of DPGs is not to create a DPG. It's actually not that difficult to create an open source product that is useful for the Sustainable Development Goals. The hard problem is making sure that it gets out there into the world, that you have a community that can support it, that you have vendors that are offering it as a service, that they're available to work long-term with these hard projects in an area that is essentially a market failure. Right. I mean, and we're trying to, go into places where they don't have the resources locally to build or maintain a lot of these systems on their own, at least at the beginning. And so jointly with the creation of DHIS2 as a platform, we have always had a combined effort through the HISP network for building local groups that have long-term relationships and footprints and are there to support systems as they grow and as they change and as new technologies come along. And we know that that's an obstacle for adoption for many of the DPGs. And part of what we really see as an opportunity for collaboration is to open up that network more to the other DPGs so that they can leverage the capacity that's been built in country, the groups that have the relationships with the ministry, and that have all of the local context, which is vital for the actual use of the DPG beyond the theoretical level that we're coming up with while we're developing it, but actually putting it in place and in practice. And that's an opportunity that, I mean, it happened very naturally anyway. The HISP network already, because they're the partner with the government, already are the ones when OpenFN comes in or when OpenCRVS comes in, that they get the first questions. They're often the ones doing integrations. They're working on these things. And what we're trying to do now is more formally recognize that and expand. And Liv Marte, you mentioned there, having donors that are interested in expanding capacity. We would love that because we want to be able to train up the HIS network more in these various technologies. And we know the kind of spillover effects that will have. The more that they understand these tools, how to use them, where they can use them, the quicker adoption will speed up and these use cases will be solved. So that's an area we're very passionate about. We have a lot of the HIS network here this week. We're hopefully having a good reception tonight, talking with the HIS network about how to do this in practice, and really excited to have this kind of collaboration.
Great, thanks, Mike. All right, so Jeremy presented a use case where we are connecting different DPGs, right? So let me ask from Alexa right now. So the thing is now, OpenFN is kind of like the critical glue, which is trying to connect different DPGs. So based on your experience working in countries and working with different DPGs, what are the kind of common integration challenges that you have encountered that we need to address?
Yeah, we're the glorified plumbers. Ask me later for where that happens. I'm sorry inside. But yeah, so some of the challenges, I think as technologists, it's really easy to dive right into the how, particularly in data integration. When we come up with a challenge, we're like, okay, how are we going to build this integration? But I think something that we really try to remind ourselves is going back to the why. After all, data is just an abstraction of real things happening. And I think particularly data integration as well, it's just a shadow of a real process that's happening in the real world. So we, in our own implementations and with partners, really trying to push folks to think about what is the value delivered by the integration? Because luckily, with APIs, interoperability ready DPGs, a lot of modern web apps, we can integrate a lot and we can automate a lot, but should we? And so that's why we've been engaging a lot with our partners. We've got a partner program, a lot of online documentation community to help people think about really assessing the value and really understanding the business requirements before actually getting into the tech. And then, of course, we've got a platform that helps you set up the integration more quickly. But I think it's really kind of, that business value, getting back to the why, capturing that, really pushing folks that are thinking about integration. Should you? And why? Like, go back to the meaning there, I think is one thing that we see a lot, and people just kind of diving right into the technical details. And when they do that, I think often I see a lot of projects that bite off maybe more than they can chew. And we see a lot of integration projects that are like trying to do so many things. And Lee was chatting a little bit earlier around, there's a big leap from an opportunity to an actual implementation, a big jump from a PowerPoint to a working solution. So something we do at OpenFN is really try to make it easier to prove value more quickly. So just start with something small. Prototype, for example, with our digital public good, we have a free cloud sandbox that you can experiment with. Some really cool new features. We've got like templates for integrations that you can use to like accelerate the work that you've been doing, as well as now an AI assistant to guide you along the way. But I think kind of really trying to get away from PowerPoint all the way to the actual thing and trying to prototype and experiment and again, like actually see parts of the process working, allow you to really solicit requirements and feedback much earlier on and kind of prove the value, which then allows folks to kind of reinvest and keep building and extending.
Great, thank you. Let me now turn to OpenSPP. So social protections. Yeah, social protection is something that really vary from country to country and different contexts. So given your work that you have been highlighting, that the number of countries that you have been dealing with, like how does OpenSPP support the local adaptation and configuration to meet these diverse programming needs that are there across different countries?
Yeah, thank you very much. Yes, so there is multiple aspects to this, and like one of the initial decisions we took when we started OpenSPP was to start on an ERP called Odoo. It's a very popular open source ERP. One of the big advantages is that it's used a lot in low and middle income countries to manage companies. So in most of the countries around the world, you would find trained developers, certified developers on this technology. So that was like one of the first things. There is more fancy, there is more modern technology, but this one has been there for a long time, and there is a lot of people, a lot of capacity behind it. So that's something that was really key for us. We are also working and more with local partners. There is partners like all around the world that are not now starting to do projects with OpenSPP, and like actually all the OpenSPP project going on now have a local partner that is working with this. And that's why also we're quite excited, like the discussion we had with Pamod initially when he said like, yeah, how can we get together and like leverage the HIS network? For us, it's an amazing opportunity to quickly get access to people who are used to work with government, that have been vetted, that are in our space and understand also open source and like how things work. So that was very important. And one thing, so we do also a lot of modules, so people can pick and choose what they do. And one thing also we're looking at, because I understand that in the HIS network, for example, a lot of people are not really like a lot of development resources. And one thing we're experimenting is how AI can be used to help developing the solution. I like DHIS2, Odoo has been there for, I think, 15, 20 years. There is a lot of open source code. And if you take like any AI model, they are very good actually at creating new modules, at developing for it. So what we're looking at also is how can we leverage this to make it easier to implement localization, customization for the local ecosystem. Oh yeah.
Great. I think one area, whenever we talk about, for example, in the context of DHIS2, the tracker programs, registries, a common thing that we all try to figure out is how to kind of ensure that we have all the clients registered, right? So ID is something very fundamental for any system that we implement, whether it be health or education or agriculture. So Arun, like I know now you have been working again with so many countries having very large scale implementations. And we, especially as the University of Oslo and the HIS group, we have a research arm also. So we also have some critical insights around use of ID and the impact the ID has on country systems. So given all that, what are the considerations for interoperability, data security, and patient privacy when you are dealing with the ID systems, and how has MOSIP been able to address these concerns at country level, and especially like when you are working across a couple of different systems which are already there?
Yeah, thanks so much. I think it's a very good question. It's a very good question. We're talking about foundational national identity systems, which are meant to be purposeless. It's meant to be available as infrastructure for rest of the digital economy and the government to people services can leverage. It should not automatically mean that this is the be all and end all within an economy. If you don't have a national identity system integrated, nothing moves. I think that's not the approach. It's a full spectrum. We often work with countries where a government's ability to identify who its beneficiaries are very crucial. But on the other hand, there's other end of spectrum where people want to be anonymous in the eyes of governments, because in some sense, government has multiple ways of knowing who you are and what you're doing. Like it's a full spectrum. We have to situate this conversation within that kind of diversity of implementations. Just because a national identity exists does not automatically mean that no other identifiers or identifications system should exist, right? A good way of looking at this is derived identities, right? National identity systems can act as your fundamental root of trust. This is very important, especially in resource-scarce environments where if everything was basic and universal, you don't typically need to identify who receives it. But when the resource is limited and governments want to target benefits delivery, the root of trust becomes important. Uniqueness within your system becomes important. For example, for healthcare, access and identity management is a very important consideration. Who it is, and does that person, is that person the same person that they claim to be? Can sometimes become very important aspects, especially when it's linked to benefits delivery or insurance or subsidization, right? We can think about derived identities in those scenarios. An identity or a healthcare system can leverage a foundational identity system and can create and operate a derived identity, because the fundamental, I think the consensus is that healthcare identity and healthcare data needs a level of privacy and security. Security is understood, but privacy considerations may be different, right? Those policies, either stringent or universal, can be now differently applied to a health identifier against a tax identifier, right? And then consent becomes an important factor, right? Typically, large-scale systems like national identity systems should have consent layers built in, especially while data is being exchanged, right? Health identity systems can leverage such consent layers to onboard only the necessary level of information into health identifier, thereby just blocking at the gate any excessive data collection. Policies around this are super important. I think the technology is there. It has to be very well understood how we are trying to disaggregate data. India is a great example of centralized identity system with Aadhaar. But then what's happening is that this race to create derived identities is now again proliferating the number of identity systems. And we're moving from a good digital identity systems to again kind of presenting different photocopies across. There's a health identifier, there's a student identifier, there is a disability identifier. There has to be a balance in how we derive identities also. Of course, this is completely separate from the health record management, which is a much more complicated layer. We're talking about identifier to be able to access and represent yourself within the system. The further layers of health record management are much more complex and it's slightly beyond identity also, but then it is baked in.
Right. I think we are going to explore a little bit further in more detail how DHIS2 can leverage and work with the ID systems. So it'll be a kind of a trigger for most of you in the audience who want to explore that path. So moving on, for Derek, now one important point that the community health systems try to address is to close this UHC gap, right? And there are many community health solutions which are there around. And how do you envision that these, electronic community health information systems, ECHIS, that you have in different countries, integrated into the larger digital health architecture? So we had a nice plenary session discussing about health architecture. So how do you envision all these ECHIS systems being integrated?
Yeah, thank you. Let's get back. Digitalization stopped at facility level. And now at UHC, that is being pushed to community level. And new systems are being introduced and also new challenges that need to be addressed. So the systems at community level need to interoperate with systems at the facility level to ensure that care given at that level is carried over to facility level. Now, and the care at facility level needs also to be available to other facilities. And that information needs to be summarized in national reporting systems. So we have a cascade of interoperability being introduced in solving for UHC. Now, in the countries we've worked, government is leading. They have a vision, they decide what tools to use, and we work around that. So DHIS2 is like de facto standard for national reporting. So at minimum, if you enter a health system, you need to interoperate with that. At facility level, you work with governments to figure out what standards they have in place, what tools they have there, and how to expose that information to that level. Also within community systems, now the standards are in place to ensure that information is tracked portably through like patient registries or like forgetting the technical term, like fire service to ensure that all those interactions are carried over across those systems.
Right. I know we are almost, our DPG session is standing between you and the lunch, so we don't want to do that, but we have two questions, two quick questions for Ed and then to Liv, which are very relevant to the kind of discussion we have been having. So a quick question for you, Ed, learning online, is, in many countries, the DHIS2 systems already collect data related to births and sometimes related to death and other vital events. So how do you envision these systems can kind of work collaboratively with the open CRVS systems so that we can make sure that we have a comprehensive, completed CRVS data for all the citizens in the country?
Yeah, thanks, Pamod. It's a very important question. The problem is a very real one. Still, we have 250 million children around the world without birth certificates before the age of 5. And for quite a long time, we've known that health systems and that touch point at birth in health systems or at vaccination can be a critical moment in a child's life to actually capture that data. Frankly, whether it's done manually or through electronic means, in order to ensure they get their birth registered and a birth certificate, at the start of their life, allowing them to access all kinds of services and rights throughout their life. Maybe if we're critical, we should point to this as a bit of a failure on our collective part. OpenCRS, for example, has had an API which exposes notifications to health systems for a number of years. We field tested this together with a HISP node in Bangladesh back in 2020. And yet our implementations of OpenCRVS tend to be somewhat siloed. Of course, because civil registration to be done properly requires collaboration, interministerial collaboration in country. So it doesn't fall necessarily to either the Ministry of Health or the ministry responsible for civil registration to own this interoperability. And so this highlights the fact, I think, as Alexa said, that these are not technical, or Mike, these are not technological problems, that the systems have interfaces which allow the systems to talk to one another to solve the problem that you mentioned. But collaboration between us as DPGs and the ministries with which we work is really essential to solve these problems from a policy and governance perspective for government.
Great, thanks, Ed. So Liv, now we talk about these collaborations and how we can support the countries. So based on your experience working with all these DPGs in last so many years, do you have any examples or country context where, like, when you are working together, the concerns that we have and how we can establish these collaborations to better support countries?
Thank you, and I'll try to keep it brief. I want to just use the opportunity to pick up on a few things as I answer the question, but very swiftly. So first of all, I think what we're seeing here is a community among the DPGs, right? And I think that's tremendously important. And I want to thank also the University of Oslo and HISP for providing that community for other DPGs, because I think that this is the result, the integrations and collaboration stories we're hearing about are also a result of trust and these DPGs actually getting to know one another. Previously, we've seen, because duplication, surprisingly enough, can also happen between DPGs in the sense that DPGs may have many similar features. And I think we're seeing more and more that there's awareness of where one begins, where the other ends, and so on. So I think that that is a result of community building and trust and familiarity and integrations, testing things in practice, to Alexa's point, to moving from PowerPoints to from Jeremy's PowerPoint to the ground.
The reality.
And then, but I do think to have this trust, there is, and I think we need to call it out, because if you have a perception of a zero-sum game, it's very, very hard to build trust. If your win is my loss, if we're competing for the same scarce resource, trust is very, very difficult. So I do think there's this financing thing we are trying to figure out, which means actually it's, and I know there's at least one donor in the room, Eric. And I think this, because the zero-sum game here should not be between the DPGs themselves. There's a very small number of DPGs out there, and I think this very tiny, in the big scheme of things, public interest landscape needs to be bolstered by some grant component. It doesn't need to cover everything. It can't cover everything in terms of country implementation and so on, but this grant component needs to be big enough for this public interest, you know, to be the lead driver of product development, prioritization, and so on. So I think we need to call out that is needed to maintain and sustain this trust. I think use cases, as I said, is tremendously important, so that, you know, helping bridge the sector silos also in the countries, because I think there are many types of silos. So sometimes, you know, Jeremy said Open SPP will be introduced in the agricultural sector, and not through, whereas most it may be coming in through a Ministry of Digitalization, like some kind of identity, like these regulators and agencies may have no idea that this others exist. And I think the DPGs themselves can sometimes help bridge that gap. And I think we're seeing that happening. So I think those are the points I would love to highlight. This, but I do think we can't just expect it to happen from the goodness of everyone's heart. So I think there is a responsibility, including on myself, to help mobilize also financing to provide more sustainability in this type of collaboration. Thank you.
Great, thanks, Liv. I know we are out of time, but it will be very unfair if we don't at least have a chance for asking one question from audience. So who wants to go? Just a quick one. Yes, Enzo.
No shot.
Yeah.
Yeah. I heard a lot of talk about involvement with LMICs, which is of course why we are here for, basically. But we have a lot of high-income countries who also have digital needs, who also have a lot of money, a lot more money than a lot of the countries that we are focusing on have, and who would provide a very sustainable source of income for all of these products. So I guess my question is, how are we working towards that? Are we working towards that? Is that an option? And how can we take space over there?
So we've been thinking about this a lot at OpenFN. We're a data integration platform. It's a universal need. And we've got corporates. I've got a kitchen supply company in Miami using OpenFN to connect different systems. How we talk about it internally is like, it is a really interesting revenue model. And like, there are some projects that cross-subsidize the work that we do more in the open source space with other governments and NGOs. But in terms of what we as an organization choose to focus on, because we only have so much time, is we prioritize the use cases where we think there isn't a market solution to meet that need. And so just taking data integration, for example, there's lots of platforms out there. There's dozens where OpenFN is trying to fit a market gap is there are platforms specifically targeting the needs that we see more commonly in LMIC countries around compliance, around open source, around deployment. There just aren't options. And so I think a lot of the DPGs here are trying to fill those market gaps. But that's not to say that they can't and shouldn't be used by other countries. And I think a lot of other DPGs, yeah.
Yeah, no, very quickly, like, I think like for us also, it's a prime of focus, right? Like the problems we see and we're trying to solve in low and middle income countries are not the same as in countries where they have a lot more resources, right? A lot of things like, for example, we're working in places where there is very few developers or there are no specific technologies, few resources, a lot of offline work also that is not really a problem in more developed countries. But like what we're looking at now also is like to help looking at organizations that can benefit from the work in the country. So for example, in agriculture, we're looking at, okay, all the agriculture value chain, and could these large agricultural buyers would benefit from having a good farmer registry in a country, right? Because there is a lot of regulation in Europe, for example, now to buy the food. There are like is they have to make sure that their supply chain is clean. And so maybe they have an interest into financing this, into supporting this into different countries.
Yeah, and just briefly from the DHIS2's perspective, so we are being approached now at least weekly, if not daily, from high income settings that want to use DHIS2. It's a very generic tool, it can be used for a lot of things. And so we've been trying to work out what is the business model for that. And it's not us, the University of Oslo, doing, but it's having a pathway for partners that do work in those systems to do that work and give a contribution back to sustaining the platform, right? We're very mission driven. We have a focus on LMICs. We're not going to start building something for Coca-Cola from the University of Oslo. But meanwhile, we invite you to build something for Coca-Cola and then have a percentage share that comes back to sustaining the network. And we're trying to actually promote this as a sustainable approach for other DPGs as well, right? So it's new, we're working on it. Tomorrow morning, there's a session on the use of DHIS2 in high income settings. We have representatives here from European CDC, other places that are adopting DHIS2. And we really hope to help kind of kick down some of those barriers for other DPGs to have this kind of a model where it's a fraction of the implementations that is paying for the bulk of the use, right? It doesn't have to be free in high income settings. They're very happy to pay. Open source still, no vendor lock-in, great. They own their system, wonderful. It's all of the objectives that we have. But Norway doesn't need a free software. They just need a good software.
I love questions like this, which triggers a response from everybody, right? Clearly, all of us have been thinking about this question. I just want to note that at least from MOSIP context, most countries attempt such large-scale endeavors as identity system once a decade or so, if not less frequent, definitely not more frequent. And it's apparent that not necessarily high-income countries get it right. What we're seeing is that some of these countries are starting from a clean slate, are doing it much better than a US or a UK or even Norway for that matter, right? So I think one risk is because of this focus, Liv, this is a kind of a challenge to you as well. One risk is that DPGs shouldn't end up getting branded as LMIC technologies, even when they're of great quality. Free does not mean bad. I think we have to almost have a kind of a collaborative approach to actively build a use case in contexts where it is high technology, it is useful in contexts other than purely social protection or anything else, that will solidify the general kind of the maturity of the technology itself. And in some level, it's beyond individual DPGs also. It's a community question. Looking for answers on all of this, definitely. But then what would be useful for us to see a developed country using this technology that gives assurances to everybody else using, because typically developed countries do a great job of marketing what they're using also, right? It's a purely from a selfish perspective, we'd love for a high income country to use some of our technology.
Right. So many interesting conversations and questions. Unfortunately, we have to close this session, but few takeaways that at least I have noted. DPG ecosystem offers scale, cost efficiency, and country of ownership, but only if we collaborate at country level, right? And there are several approaches, as Liv presented, for us to build this local implement ecosystem. And HISP as a community can, of course, play a pivotal role in fostering these linkages and technically supporting the country implementations as well. So thank you so much, the panelists here. Some of you have just come all the way, mainly targeted this particular session. But I know you must have had so many engagements with our community throughout this week. And thanks again for everyone in the audience as well. Just one announcement before we close. So we have one more session tomorrow morning. It's actually a 2-hour session conducted by Apt Institute. So Aisha is here. Yes. So that session is on building communities around code, navigating challenges of community building through play and negotiation. So it's going to be a very interactive session. So I invite all of you. It will be at 108 room on the other side. So please join that session as well if possible. So it's a 2-hour session, very interactive one. With that, we can close this session. Thanks a lot to everyone for attending this session. So we'll keep this session going. Thank you very much.